Good, good afternoon to everyone, and welcome to this afternoon session of this multi-stakeholder event celebrating the 10th anniversary of the ILO Convention 189, and also trying to identify strategies and approaches going forward to get more countries in the European Union to ratify such an important convention. I really was amazed. I don't know about other people, but I was really amazed by the initial introductions and contributions that we heard this morning. It was really great data and new data that we got from the ILO. So thanks again to Claire. And I really appreciated Martha Newton's speech. What an optimistic and hopeful speech in such, unfortunately, dark times. And it's always great. And I'm particularly happy in the context of this meeting that we managed to get Commissioner Nicolas Schmit to give such a wonderful intervention that focused on gender equality, trade union rights, alleviating inequality for families. So I think his speech really touched upon all the crucial elements that we're going to be discussing today and tomorrow. For those who don't know me, my name is Mark Bergfeld, and I'm the Director of Property Services and UniCare at the European Trade Union Federation Uni Europa. I've played a role in the Advancing PHS project over the last 2 years. And in my previous life, I was a researcher, and I particularly looked at how domestic workers could organize and self-organized. And nowadays in my job at Uni Europa, I try to identify ways in which we can improve collective bargaining coverage and develop union structures, in particular for those workers in the home care section of domestic work. So today we have in this panel, and I'll just share my screen so that all participants can see whom we have lined up for today's meeting. We'll kick it off with an introductory video by the Belgian trade union ACV-CSC. And as you know, Belgium has a very particular system of regulating domestic work. And it's very great that they've been doing a lot, together with immigrant worker organizations over the last few years. So it's very great that we can have this video. Then we'll have Carmen Grau Pineda of the University of Las Palmas de Gran Canaria, and Gemma Quintero Lima from the University of Carlos III in Madrid. So it's great to, we have practitioners from ILO, the trade union movement, employers. So it's also great that we can have academic researchers. And Carmen and Gemma, just for all of your information, will be speaking in Spanish. So all you English speakers, please make sure to put on the interpretation so you understand what's happening. Then we'll have Wendy Galarza, my great colleague from Philcam's CGI-IL, and Wendy will be speaking in Italian. So it's great to hear from Wendy because they've been really at the forefront of and developing some very innovative approaches in the domestic work sector. And then we'll have Brid Gold from Sodexo Home Care. And actually, Brid and I have been at a meeting recently that I organized on, tackling labor shortages and high labor turnover in the home care sector. So I'm really happy to have Brid here again with us today. And she always has some very prescient insights for people. And then we have Anna Rosinska from the University of Venice, and Elizabeth Pellerito. And Anna, I'm really happy. She's recently published a report about home care, domestic workers in the United States. and her report details some of the effects of the COVID-19 pandemic had on them. So, and it's a very interesting report. So maybe, Anna, you can also share it in the chat so people can access the PDF if people are interested. And lastly, we'll have the DOM equal video. And before we play that video, I'll say a few more words about that. That being said, I'll hand it over to Dimitris, who will play the introductory video.
Heel typisch aan het Belgische systeem is dat de sector van huisarbeid heel erg gesubsidieerd is. Dat heeft het grote voordeel dat huisarbeiders een legaal statuut hebben, met alles erop en eraan. Hun eigen loonvoorwaarden, de toegang tot de sociale zekerheid en er wordt zelfs, wat typisch is voor België, onderhandeld op het nationale niveau. Op het nationale niveau worden de minimumvoorwaarden, de minimumlonen en arbeidsvoorwaarden afgesproken tussen enerzijds werkgeversfederaties en anderzijds vakbonden. Dit kan trouwens ook op het ondernemingsvlak gebeuren, want huisarbeiders die werken via het systeem van de dienstenchecks, die kunnen ook lid worden van een ondernemingsraad of een lokale delegatie, waardoor zij eigen loon- en arbeidsvoorwaarden kunnen afspreken binnen het bedrijf. Zoals ik al zei, het is een zwaar gesubsidieerde sector en dit heeft natuurlijk ook zijn grenzen. Want door de tijd heen ervaren wij dat de subsidie misschien niet meer voldoende is of dat de klantbijdrage moet opgetrokken worden, zodanig dat wij in de toekomst in de mogelijkheid zijn om nog betere loon- en arbeidsvoorwaarden af te spreken voor onze huisarbeiders. Een bijkomend voordeel om te kunnen onderhandelen op nationaal sectoraal vlak is dat wij binnen de sector van de huisarbeid ook erin geslaagd zijn om een vormingsfonds op te richten, een sociaal fonds. Dat betekent dat mensen die bijvoorbeeld een tijdje niet aan het werk zijn of een aantal uren minder werken, in bepaalde gevallen kunnen een bijdrage krijgen, een bijleg krijgen van het sociaal fonds. Wat nog belangrijker is, is dat mensen ook recht hebben op professionele vorming die geallieerd wordt aan het uitoefenen van de job, waardoor dat wij huishoudhulpen beter kunnen begeleiden en beschermen tegen arbeidsongevallen of ziekten die rechtstreeks met het werk te maken hebben.
Okay, thanks to Pia Stalpert from ACV, the General Secretary from ACV CSC, and our colleagues from EFAD, who I imagine organized the video. So we'll get things kicked off right away. I'll allow the two researchers to start presenting their work. You have approximately 10 minutes. And after 10 minutes, I'll just say like, hey, you know, like, please try to wrap it up. And as I said before, they will be speaking in Spanish. So the floor is yours. Thank you very much for joining us today.
Buenos días a todos y a todas. ¿Se me oye correctamente? ¿He compartido la pantalla correctamente? Bonjour à tous, good afternoon. Okay, it's all okay. Es para nosotras un placer presentar en este evento europeo que conmemora el 10º aniversario del convenio 189 de la OIT, la aportación firmada junto a la profesora Quintero Lima, que lleva por título a ver. una nueva... Disculpen, pero no veo, no puedo pasar mi presentación.
Excuse me, we are hearing two interpreters on the same channel.
Carmen, comparte abajo, ponlo en modo presentación para que puedas verlo entero también.
A ver, sorry about this. Ok, compartir pantalla.
No.
Compartir pantalla, ok. It's okay.
Déjame que te lo comparta yo.
Gracias.
Yeah, that's
Okay.
good. Bueno.
Okay, it's perfect for me. Thank you very much, Gemma. Okay, perfect. Sorry about this. It's the technology. Ok, buenos días a todos y a todas. Bonjour a tous and good afternoon. La profesora Gemma Quintero Lima y yo tenemos el placer de presentar en este evento conmemorativo del 10º aniversario del convenio 189 de la OIT la aportación que lleva por título una nueva política de conciliación, la oportunidad de formalizar el cuidado. Gemma, ¿puedes pasar? Sí. La siguiente. Bien, nuestra aportación se centra en dos ideas principales que desarrollaremos de forma sucesiva a continuación. Por un lado, la necesidad de deconstruir la feminización del cuidado y, en segundo lugar, el potencial de subvencionar el cuidado como política de conciliación. Empezando por la primera, hay que señalar que desde hace ya varias décadas se han venido desarrollando acciones dirigidas a promover la conciliación entre la vida laboral y familiar de las personas trabajadoras y que han sido eminentemente reformas legislativas en el ámbito del derecho del trabajo y de la seguridad social, las que han ocupado el papel protagonista en la consecución de este hito. Con ella se ha intentado incorporar nuevos mecanismos jurídicos como los permisos, las excedencias y las reducciones de jornada, medidas todas ellas que han posibilitado que la conciliación se concrete de forma casi exclusiva en derechos de ausencia del lugar de trabajo. Frente a ello, la realidad es que resulta fundamental que hombres y mujeres se impliquen por igual en los cuidados familiares a través del reconocimiento de derechos de titularidad neutra, es decir, no solo reconocidos por igual, sino ejercidos de forma equitativa e igualitaria. Pero el fomento de este disfrute igualitario, no siendo solo una cuestión jurídica, requiere sobre todo de un cambio social. Y es que pese a los esfuerzos normativos más o menos certeros, los esquemas de conciliación clásicos requieren de un cambio sociológico más profundo, encaminado a la construcción de la corresponsabilidad o, en sentido negativo, a la deconstrucción de la feminización del cuidado. Y para ello es imprescindible que las tareas de cuidado sean asumidas equitativa e indistintamente por los dos miembros de la progenitura, desmontando el reparto tradicional de roles del modelo patriarcal. En la práctica se constata una cierta resistencia a seguir considerando que tanto las tareas como los cuidados intrafamiliares sigan siendo cosa de mujeres y un asunto que debe resolverse dentro de la familia. Siendo cierto que los niveles de corresponsabilidad han aumentado, también lo es que no es suficiente y que será preciso externalizar parte del mismo, bien mediante el recurso a servicios públicos de cuidado, si los hubiera y si se percibieran como asequibles y de calidad, bien mediante el recurso a servicios privados de cuidado y con carácter absolutamente preferente a través de la contratación directa de personal de servicio doméstico. Las nuevas políticas públicas de conciliación, pasamos a la siguiente, Gemma, precisan no solo de reformas legislativas como ha ocurrido hasta ahora, sino de una intervención pública firme y clara sobre la vertiente económica del cuidado mediante la transferencia de recursos monetarios, directos o indirectos, a aquellas personas trabajadoras, eminentemente mujeres, pero también hombres, que no tienen medios económicos para externalizar el cuidado. Y en este sentido es importante destacar como el impulso que el debate internacional respecto de la mercantilización del trabajo doméstico y de cuidados y la inclusión de una política de corresponsabilidad que incluya al Estado, la sociedad y la familia ha sido determinante. Tanto la Agenda 2030 y su ODS quinto sobre igualdad de género como el Convenio 189 de la OIT sobre trabajadoras y trabajadores domésticos han tenido un efecto innegable en el cambio de paradigma que supone que la práctica de cuidar no tenga género y apostar por alternativas en las que se promueva un cambio real de paradigmas sociales respecto de los cuidados. Pero también en sede nacional, en España, hay que destacar los avances en este sentido. El máximo exponente ha sido el plan anunciado por el Gobierno de España a principios de marzo de este mismo año y que, más allá de contribuir a la conciliación y corresponsabilidad, pretende crear, con una importante inyección de recursos económicos, empleo de calidad en el sector de los cuidados, dignificarlo y certificar la experiencia profesional del cuidado no formal. Sobre los detalles de esta iniciativa les va a hablar a continuación la profesora Quintero Lima.
Les pido disculpas que tengo que volver a compartir ahora, a ver si soy capaz. La profesora Grau hablaba de un experimento. Como todos los experimentos, es un piloto que está pendiente de implementación completa, implementación política completa, que se enmarca en un complejo jurídico político constitucional español relativamente complicado, porque el plan corresponsable lo lanza y lo proyecta el Ministerio de Igualdad, pero tiene que ser implementado en la medida en que es una política semilla en la que están implicadas muchas competencias autonómicas. Decía, es una política que va a necesitar de las 17 comunidades autónomas y nuestras 2 ciudades autónomas para desarrollarse de una manera efectiva. Pero lo interesante es que se trata de un plan que ya tiene presupuestado 190 millones de euros, no está mal, en el que se proponen 3 tipos de proyectos a esas comunidades autónomas para que en el marco de sus competencias y en su propio desarrollo jurídico-económico puedan llevar a cabo. Los 3 ámbitos de proyectos plausibles tienen que ver con generar bolsas de cuidados para menores de 14 años, bolsas de cuidados con los que se imbriquen proyectos, por otro lado, de creación de empleo de calidad. Empleo de calidad en el que se fomente el desarrollo profesional de jóvenes personas tituladas en competencias de cuidado, no de cuidado directo de menores solamente, de personas con discapacidad, sino en todo el elenco de atención sociosanitaria y técnico-educativa, y al mismo tiempo incorpore a aquellas personas, eminentemente mujeres, eminentemente mayores de 45 años, que no pueden acreditar una experiencia profesional estándar, pero que sí pueden acreditar experiencia en gestión de cuidados no formales. Y por lo tanto, en ese ámbito se imbrica un tercer proyecto, que es el de acreditar y validar experiencia profesional, algo que en España, igual que en otros países, sí que está bastante desarrollado, pues en España no tanto. Estos son los 3 proyectos que obligatoriamente las comunidades autónomas, si quieren recibir esa dotación presupuestaria que les sea asignada, pues tienen que desarrollar de una manera equilibrada. Tenemos un referente muy interesante en el que vamos a encontrar algunos ejemplos de ese subvencionar el cuidado como política de conciliación con un efecto reflejo de dignificación del trabajo doméstico, que es el primer plan de corresponsabilidad de la Comunidad de Madrid. Fue publicado el 5 de marzo al hilo de la celebración del Día de la Mujer, pero tenemos que decir que está en stand-by, porque por razones políticas se convocaron elecciones anticipadas en la Comunidad de Madrid y es un programa que ahora mismo está pendiente de desarrollo a expensas de que el gobierno autonómico termine de ser conformado y los actuales responsables políticos de las consejerías competentes puedan decidir cómo desarrollarlo. Pero aquí lo interesante es que este plan de corresponsabilidad partía, y lo hacía formalmente, como una hoja de ruta para tratar de implicar a progenitores, familias en general, poderes públicos, empresas, en el cuidado, como una idea de que la corresponsabilidad es un elemento formal de consecución de la igualdad de oportunidades de las mujeres en un marco de una nueva sociedad de los cuidados y de cuidados de calidad. Y esto tiene que ver, entonces, y por eso es un ejemplo de este potencial del potencial de subvencionar el cuidado, porque en este plan corresponsable se establecen 3 bloques de medidas interesantes. La primera se manifiesta en un elenco de ayudas para complementar los salarios de aquellas personas que han reducido su jornada para el cuidado de menores. Se trata de un bloque de ayudas pensadas para que sean las empresas quienes gestionen las ayudas recibidas, para que aquellas personas que tengan ingresos anuales, aquellos trabajadores de empresas de menos de 100 trabajadores que han reducido su jornada por cuidado de menores de 12 años y que tengan un salario bruto inferior a 13.300 euros, son cantidades que ponen de manifiesta pues, un elemento de selección del colectivo subvencionable. Bueno, pues para estos habrá una transferencia de recursos para que las empresas, decía, complementen los salarios que se ven reducidos como consecuencia de la reducción de jornada. Y aquí lo interesante es ese elemento de favorecer la conciliación de una manera diferente. Pero hay otro segundo bloque de acciones autonómicas que se concreta en ayudas para que los ayuntamientos puedan contratar a personas cualificadas, es decir, con cualificación en un sentido amplio de los cuidados, para que puedan ofrecer ayudas a familias que necesiten atención, o mejor dicho, cuidados para sus menores y personas no dependientes, y por lo tanto la comunidad lo que va a hacer es subvencionar el coste de la contratación de estos sujetos, al mismo tiempo que va a subvencionar la formación de estas personas que sean contratadas para ofrecer servicios a las familias de cada municipio.
Gemma, could I just interrupt you? Your 10 minutes in total are over now, and I know you still have something to say. 1 minute? Okay.
No, 30 seconds. 30 seconds.
Okay, I didn't.
So I have some problems with my PowerPoint, but in any case, en todo caso. Y el último más interesante es en el que se van a convocar subvenciones o ayudas para la contratación de personas de trabajo doméstico siempre que sean contratados de una manera formal, se cotice por ellos y con una duración contractual mínima. En todo caso, aquí lamento que no puedo seguir compartiendo, y aquí lo que quería ver es ese elemento condicionado de la subvención convencionada en la que se permite la conciliación de personas mediante la externalización subvencionada del contrato, porque aquí lo interesante es que a través de este mecanismo, sin querer o queriéndolo, los poderes públicos consiguen redignificar el sector de los cuidados, del sector del trabajo doméstico, mediante el establecimiento de condiciones dignas obligatorias a través de una subvención, a través de políticas públicas, en realidad de corresponsabilización público-privada del cuidado. Perdonad por el tiempo, que con las cosas técnicas, disculpad. Thank you. Merci beaucoup. C'est un plaisir.
Gracias. Thank you very much for your presentation. I think, talking about conditionalities will be on many people's minds. So maybe we can pick up that discussion in the Q&A later on again, because I think there will definitely be some questions, and I think it's very interesting. It's a very interesting and progressive idea coming from Madrid. So thank you very much for your presentation. Next up, as I said, we have Wendy Galarza from CGIL Field Camps. And Wendy, you have 8 minutes, so I'll be timing you.
Buon pomeriggio a tutti, sono Wendy Paola Galarza e il mio tema è il diritto del lavoro e i quadri di protezione sociali, delle lacune normative al riconoscimento dei diritti dei domestic workers. Allora, noi, come molti di voi sapete, in Italia abbiamo un contratto che è in essere già dagli anni 70, dai primi anni degli anni 70. Il primo articolo di questo contratto è la sfera di applicazione, una sfera di applicazione che il presente contratto dice che va stipulato tra le parti datoriali e le parti sociali, cioè tra i datori del lavoro che si sono organizzati in associazione e le parti sociali che sarebbero i sindacati. Un contratto che è esigibile, che permette di chiedere e di garantire al lavoratore diritti fondamentali come le ferie, l'organizzazione dei tempi del lavoro, i riposi, la paga base, le ferie e tante altre cose. Ha le sue lacune come tutte le cose quando riguardano il mondo del lavoro domestico, anche se abbiamo tanti anni ci sono delle lacune anche in Italia. Queste lacune però noi cerchiamo di colmarle con azioni politiche congiunte, sia dal punto di vista sindacale che dal punto di vista delle parti dei datori di lavoro. Va detto che comunque la retribuzione al funzionamento della vita familiare dei lavoratori è strutturata sia quando si è un lavoratore di questo settore che presta una missione del riassetto della casa, che cucina, e quelle che vengono dette badanti, che non sono altre che le lavoratrici della cura, che spesso vivono H24 con gli anziani, con le persone disabili, con le persone non autosufficienti. Va detto che questo contratto è esigibile anche a tutto il territorio, perché se viene dettate le condizioni del miglior favore, cioè chi viene da fuori non è che verrà applicato un contratto diverso, no, viene applicato il contratto vigente nel territorio italiano per tutte le persone che arriveranno. Poi noi con questo contratto abbiamo anche un pezzo che si chiama la bilateralità, che non è altro che una contrattazione di secondo livello, con il quale possiamo dare formazione e colmare le lacune che facevo riferimento prima alle lavoratrici. La formazione va espletata in questo modo: i corsi certificati con la legge numero 4 del 2013, nel quale ogni lavoratrice ha un codice registrato all'INPS, nel quale dice che è una lavoratrice formata da noi o comunque di tutti gli enti formatori, quindi alle certificazioni, perché come voi sapete, visto che parlate spesso del mondo del lavoro domestico, la grande difficoltà che riscontriamo tutti è che nel mondo del lavoro domestico è un mondo informale, quindi le lavoratrici, anche se hanno esperienza, anche se hanno delle capacità, delle qualifiche, non c'è un modo di certificarle. Noi questo modo lo abbiamo trovato già dal 2013. I quaderni di salute e sicurezza, sapete benissimo che è un mondo del lavoro nel quale si lavora in solitudine e isolamento, quindi come raggiungere le lavoratrici per farle capire cosa c'è che non va, soprattutto perché molte lavoratrici non parlano lingua italiana o comunque non la parlano alla perfezione e ci sono delle cose che non riescono a capire semplicemente leggendole. Quindi noi abbiamo fatto questi quaderni salute e sicurezza che sì, hanno dello scritto, ma hanno anche le indicazioni con i disegni, in modo che là dove non ci arrivi con la lettura, con la comprensione della lingua, c'è il disegno molto intuitivo che ti fa capire quale è il pericolo. Purtroppo dobbiamo fare anche i conti con la pandemia, quindi in tempi di pandemia cosa abbiamo fatto? Abbiamo organizzato i videocorso Covid-19 per far comprendere a tutta la platea delle lavoratrici e spesso anche dei datori di lavoro come bisognava comportarsi, come bisogna comportarsi in questo momento di pandemia, che cosa bisogna fare, che cosa non bisogna fare. Invece dal punto di vista di Cassa Colf, che è il nostro ente, un altro pezzo della bilateralità, noi troviamo in questo momento di pandemia abbiamo fatto una indennità giornaliera in caso di ricovero, perché se le lavoratrici sono ricoverate sapete che devono avere comunque un sostegno economico, quindi c'è questa indennità del ricovero che sono 30 euro al giorno per ogni lavoratrice. Poi e le indennità di convalescenza, perché quando esci si fai un intervento o qualcos'altro, comunque avrai del tuo tempo per recuperarti e essere al pieno delle tue capacità per tornare al lavoro. E non è un periodo che è gratuito, è un periodo che va retribuito. Indennità per i figli a carico, il rimborso per le malattie riabilitative, rimborso per le visite domiciliari. Insieme a tutto ciò, in tempo di pandemia si è creato anche un fondo ad hoc perché le signore potessero passare i giorni, 14 giorni di quarantena o i giorni finché erano negativizzate del Covid, avendo comunque un sostegno economico che le permettesse non solo di riprendersi fisicamente, ma dal punto di vista psicologico. Perché? Perché voi sapete che comunque sono donne che lavorano, sono donne migranti che comunque devono mandare delle risorse a casa, perché probabilmente anche a casa c'è qualcuno che sta male e ha bisogno, ha necessità impellente di quelle risorse. Mi avvio verso la fine perché 8 minuti sono pochi, io ho tantissime cose da dire. Nelle lacune che noi abbiamo, non è che siamo stati mano nella mano negli anni e soprattutto nell'ultimo rinnovo contrattuale che c'è stato in piena pandemia, cioè l'8 settembre del 2020, quando abbiamo rinnovato il nostro contratto nazionale. Successivamente al 14 gennaio del 2021 le parti datoriali, congiuntamente con le parti sociali, hanno presentato al governo una piattaforma programmatica. Io vado velocemente a raccontarvi cosa c'è scritto in questa piattaforma programmatica, provando a rientrare in tempi. La piattaforma programmatica prima cosa ci dà questi numeri. 88% sono donne in questo mondo del lavoro, il 73% sono donne migranti, il 45% impiegate in questo mondo sono adette al mondo della cura, cioè alle badanti. Il 44% sono donne migranti di origine europeo. Il 10%, cioè 2.100.000 sono lavoratori subordinati, una grossa quota del lavoro subordinato in Italia. Il 12%, cioè il 2.500.000 dei datori di lavoro, è una famiglia privata. Tra i lavoratori, la somma tra i lavoratori e le lavoratrici, parliamo di una platea comprensiva di 9.500.000 persone che danno un gettito economico al paese. Quindi se tu produci ricchezza e elargisci ricchezza, quella ricchezza deve essere anche contestualizzata dentro il paese, il tuo paese, la tua nazione si deve preoccupare e darti la possibilità di vivere meglio sia da una parte che dall'altra. Poi i 5 punti, quello per il quale noi ci stiamo battendo fortemente: la maternità. Le lavoratrici domestiche adesso hanno un inquadramento di maternità come le abbiamo tutte le altre, ma le lavoratrici subordinate di altre categorie e di altri segmenti produttivi hanno altre agevolazioni che ad oggi le lavoratrici domestiche non possiedono. La malattia INEL, questo contratto garantisce solo al 65% la malattia alle lavoratrici domestiche, ma noi andiamo a integrare con ciò che vi dicevo prima, cioè cassa colf. Poi la fiscalità agevolata, perché questo è un discorso, questo è un discorso che dovrebbe
Wendy,
essere... Sì?
Sorry to interrupt you, could you please sum up?
Yes. Questo è un discorso che va fatto in due parti, sia dal punto di vista del datore del lavoro che delle lavoratrici. La fiscalità agevolata è fondamentale perché permette che le famiglie, e spesso pensionati, possano accedere al mondo, a avere un'assistenza degna. Le politiche migratorie devono essere diverse per le lavoratrici domestiche e in ultimo chiudo, bisogna abbassare il costo del lavoro perché solo così riusciremo a eliminare il lavoro illegale che è molto alto nel nostro paese e anche nel resto dei paesi. Io vi ringrazio, sicuramente vi posterò sulla chat i punti in modo che ve li andate a leggere. È il link del nostro contratto nazionale. Vi ringrazio.
Grazie mille, Wendy. Thank you very much. And for those who are attending today's event, the next session after this session will actually deal with tackling undeclared work. So I think Wendy's final points really lead into that discussion. So next up, I've just lost 1 second. We have Brid Gold from Sodexo Home Care. Hello, Brid. It's good to see you again. And you'll also have 8 minutes to present some of your ideas and some of your work. So I'll let you know after 8 minutes.
Thank you, Mark. Hopefully you can see my slides. Good afternoon, everyone. Delighted to have the opportunity to present to you over the next couple of minutes. I suppose I come very much from the point of view of the employer and an operator in home care, and just to give you a sort of brief overview of our experiences, and particularly over the last 15 months in the pandemic. This slide, I think everyone probably knows it very, very well, some of the trends that we have in home care, so I'll briefly run through it. We obviously have, you know, an increase in our seniors, set to double in the next 30 years. According to AARP in the US, they are citing that 6 in every 10 seniors want to stay at home. And a research in Ireland, the ERSI, the Economic Research Institute, cites that 85% of seniors want to be cared for in their own homes. We very much have a supply-demand challenge across all of our home care entities in Sodexo, and one that I know very too well as well from the industry point of view. And I suppose welcome the conversations today and how we work in better partnership around trying to solve some of those challenges. Care is getting more acute in the home, so we've very much moved away from the scenario of 10, 15 years ago, where it was very much around companionship care. It's very much more dependent, so we have much sicker and iller service users now. And I suppose trying to ensure that we have a skilled workforce to ensure safe care for everybody in the home. And I suppose the final one to touch on this slide is that severe shortage and retention challenge we have in healthcare. And when that comes down to home care, back out into the community, it even becomes more strained. The WHO cite that we currently have 5.9 million shortage of nursing, and I'm sure that's increased throughout the pandemic. There's lots of studies, not enough in relation to home care workers, but a lot in healthcare, citing people's mental strain during the pandemic and citing that they will plan to leave healthcare jobs in the future. 79% of agencies cite their #1 challenge as recruitment and retention. And across our entities, we see a turnover challenge in care at around 35%. I suppose when we talk about it, and I know it's sometimes hard to see it from the other side around what is the challenge and what does it actually really mean. Some of the challenges our home care workers experience today are very much around the quality of work that's afforded to them. So that transactional model of work, so moving between households, maybe on averaging 7 to 8 households a day, that split shift, so some work in the morning and some back out for work in the evening. Pay, of course, is a challenge and will continue to be a challenge around, you know, how do you remunerate that and how do you ensure that you know, you have our employees have quality of life across all of the important metrics. Burnout is significant in care, particularly in home care. It's predominantly lone worker going into environments that are residential settings that are now workplaces, and the challenges of that. Rural areas, so our geographical landscape being very, very challenging, and lots of commuting and travel. And in that first graph there, in graph A, you can see that just illustrates turnover. So the more travel a carer has, the more likely they are to leave their position. Healthcare is a constant change, which most people are aware of. We've a moving client base constantly. So clients move in and out of hospitals, so there's no set routine for our carers. Training is a challenge. And I suppose the more complex our clients have become and service users, how do we meet that training need? Lack of affordable housing, so particularly in our urban areas, there not being affordable housing, and also not enough rental accommodation for our staff to avail of. Time to hire due to that complexity has increased. Childcare care is 365 days, and our childcare models unfortunately are not, or supports around childcare. The sector has also a significant problem attracting younger staff and then retaining them, and graph B illustrates that. I suppose that we have a high turnover in the under 30 category. And then COVID itself, I think for the future in care, we will have a significant challenge in keeping people in the sector, never mind home care, in healthcare. And the Irish Nurses and Midwives organisation recently in Ireland revealed that 61% of staff have contemplated leaving the sector. This slide is more just of an illustrating of some of it's an infographic that the State of the Adult Social Care Sector in the UK published in October. And I suppose two numbers that I thought were incredibly, came across very strong in it, but obviously incredibly disappointing for our sector, is that we obviously have 66% of leavers that leave do stay in home care, but what they do is they move from provider to provider, trying to find those maybe optimum terms and conditions, or where they feel valued or looked after. And I think it's one that we have to look at. There is still, of course, an issue around 0-hour contracts and how we find the balance of that, because we will have seen in our own experience where caregivers will have liked the flexibility of 0-hour contracts versus a contract, and how we find the right contract type for caregivers in the future. But again, you can see clearly evidence again of turnover rates at around 30%. Care in COVID. I think right across the globe for Sodexo Home Care, we have seen low exposure rates of COVID in home care. It's been a very safe place to work in and to be cared for. And I suppose as an employer, what did we do and how did we ensure that the super work of our frontline staff was protected? And I think that was to prioritise safety as the number one thing, to only ever follow public health guidelines, and to ensure that they had the appropriate training for what they needed to do, from PPE to the guidelines as they changed and evolved, which in the early days they did very, very frequently. Quite interestingly, turnover of staff decreased at that time, and I suppose lots of sectors saw that because there wasn't movement of people. But in our situation, there was a real call to action, and there was a real collaboration and partnership of work together. And I think we've learned an awful lot around that from our staff. Tech very much supported care, but that human touch of having interactions with supervisors and managers became very, very important too. Communication and flexibility. And when we talk about flexibility, flexibility from the commissioner of work, so if it's government work, how that was being commissioned and how we worked together. Flexibility with clients and families, so we worked much better as in collaboration with each other in COVID than out of COVID, and I'd hope we can take some of those learnings into the future as well. Well-being and doing meaningful sessions about it. We all talk about well-being and mental health, but really listening to our clients and carers around what mattered to them, and actioning their feedback throughout our communication and surveys that we did. and becoming a trusted source around vaccines. So a lot of our staff turned to us when the vaccine program started. So how did we help them to either access vaccine programs or information around the vaccine program in those early days?
Bird, could you please sum up if you can?
I can.
Thank you very much.
So in my in this last slide, I suppose I just wanted to share with you some of my thoughts around some sustainable solutions for care, and none of these are new, and it's unfortunate that we haven't probably acted on some of these. And I think we have a great opportunity coming out of COVID to be much more proactive around them. We definitely need better commissioning of work going forward, particularly in those countries that the state are the dominant commissioner of care. Better contract choice, so how staff can engage with us around the contract that is legal for them to work around. The legalization, I suppose, of sick pay and pensions, and we see that coming in some countries, and we really welcome that, and particularly my own country in Ireland. It's due in the next few months, and we absolutely welcome that, and we hope that there will be no delays in relation to it. Career pathways incredibly important, so how we set up apprenticeship programs for care and ensure that our we're enticing the youth of today to come into the sector and that they see it as a purposeful and meaningful career for the future. And I think childcare supports as well can be incredibly helpful to our staff as well, to be able to continue, particularly a female-dominated sector. Wherever we can look at tax incentives to keep people in the sector to ensure that they can stay living in our urban areas as well. And overall, my last point is around the culture in care needs to continue to change and evolve. Healthcare is change, and the culture needs to evolve to that. And I'd hope that what we've learned in the last 15 to 16 months, that we continue to work in partnership, in collaboration, to ensure that our seniors can continue to be cared for at home, and that our employees continue to be able to meet that need and that societal need that is so incredibly important. Thank you.
Thank you very much, Britt. I think your last point particularly chimes with the initial point that Gemma and Carmen raised about the cultural change and like what kind of policy proposals derive from that cultural change that is necessary. And as you know, I'm very interested in labor shortages and levels of labor turnover. So you've really added another dimension to the discussion we've had in a couple of weeks ago. That being said, I still want to get lots of people in the question and answers, and I always end up being the chair for some reason, and I'm too lenient. So being said, Anna Rosinska and Elizabeth Pellerito will be presenting some of their research that draws upon the United States. So I think, given the context, new political context in the United States, I think it bears some very interesting lessons for us. So thank you very much for joining us today.
Thank you so much, Mark, and thank you to the other panelists. My name is Elizabeth Pellerito, and my colleague Anna Rosinska and I will be talking about some of the work we've done on the US context, and particularly on the intersection of immigrants' rights and workers' rights, and how that has played out in the pandemic. And as Mark said, also during this very complicated political shift. So we will very briefly just touch on an overview of the domestic workers' legal situation in the US for context, and talk about the pandemic and the ways that it has sort of a split effect on a very precarious sector already. And then the bulk of our presentation will be thinking about the advocacy efforts of some of the organizations that we looked at in a variety of ways, and then just thinking broadly about reopening and what that looks like. So a few pieces of context that we wanted to make sure that we mentioned is that first, it's important to understand that in the US, the sector of domestic workers have been excluded from most federal labor law. And this is rooted in a number of reasons, but very specifically because post-abolition of folks who were enslaved in America, many Black women in particular went into the domestic work sector. And we see that all of the federal sectors, all of the labor sectors, with workers who were largely represented by formerly enslaved peoples were carved out of the federal labor laws that were passed in the 1930s during the New Deal. So actually the National Labor Relations Act, which is passed in 31, I think, until 1974 actually excluded domestic workers as a category. And there continue to be carve-outs in the Fair Labor Standards Act, which governs minimum wage and overtime laws, as well as OSHA, which is the Occupational Safety and Health Act, completely excludes the sector. Any employer with fewer than 10 employees is not held liable under OSHA. However, there are many states that have passed a state-level OSHA health and safety bill, and many of those do include domestic workers. And on that note, there are 10 states and 2 cities that have actually passed their own domestic workers' bills of rights that do cover some of the gaps in the federal law. And there is a campaign currently for a federal bill. And I'll just note also that it's important to recognize that in the US context, most domestic workers are not in trade unions. They are represented by worker centers, which don't have federally or state recognized rights of representation. They are more of a voluntary organization. There are some unions, like the union that I'm a member of, Service Employees International, does represent many care workers and personal care attendants, but that tends to be the exception rather than the rule. Broadly, we found that during the pandemic, as you might expect, the precarious sector of domestic workers found themselves in one of 2 very different situations, both of which were very difficult on the workers. So either because of stay-at-home workers, where white-collar sectors were working remotely, working from home, domestic workers found themselves completely out of work suddenly, or they were required to work even extra hours and in dangerous conditions with very little access to things like PPE. Another important piece of the US context, I think, is that most domestic workers have little or no access to medical insurance whatsoever. And so one of the things that Anna will talk about is kind of the sort of public health narrative that's built around some of the advocacy that protecting and giving health benefits to domestic workers actually protects wealthier white collar people, frankly. And then the final piece to recognize is that amid all of the stimulus bills that were passed during the pandemic, many of the domestic work sector is undocumented, so they lack citizenship, and many of them were excluded from those relief measures or were afraid to access things like healthcare and relief because they were afraid of being deported, and particularly during the pandemic when travel is closed down, it became a mess. So I will pass it to my colleague Anna, who will talk more about some of the advocacy efforts.
Thank you, Mark. Thank you, Elizabeth. Can you keep your slides on? Could you? Okay, great. So I will try to be very brief, although it is quite challenging to, share with you everything that we prepared. So I am going to mention 3 things that were connected to the advocacy during the pandemic. First of all, domestic workers organizations, while they were operating on the ground as shock absorbers for all the workers who, as Elizabeth mentioned, lost their jobs and were really struggling financially and economically, At the same time, these organizations were very, very active, pushing for advocacy, pushing for inclusion of domestic workers in the general relief measures. It's very important to understand that while these laws were being passed, there were a lot of discussions that had to do with the category of workers, the category of businesses, how much money can you make yearly to be eligible for certain benefits. And the organizations were just making sure that as a sector, they weren't being excluded. This included emergency unemployment benefits, for instance, or something that was called economic impact payment, more commonly known as stimulus check, that supposedly everybody in the United States received. But of course, as Elizabeth said, undocumented workers were excluded from all these emergency measures. Next slide, please. The second type of action, or like the second type of advocacy, was, we may say in the hindsight, was focused around the issues of essential work. We have heard this term in Europe, sometimes a term like such as key workers is being used, and this is a term that comes with a lot of baggage, and there's a lot to unpack here, and we're not going to have time for it, unfortunately. However, what we found is that domestic workers organizations were trying to really skillfully navigate this discussion to the benefit of domestic workers. So the main reasoning was like this: okay, so if you think we are essential and we need to report for work, such as personal care attendants were, we really need to have coverage, we need to have protections, we need to have PPE, for example. So there was a very interesting initiative on the federal level that was put forward, among others, by Senator Elizabeth Warren from Massachusetts. That was Essential Workers Bill of Rights, that in contrast to those general bills that I mentioned a moment before, was trying to address the needs of frontline workers in a more particular or specific way. Next slide, please. This brings us to like the last point that I wanted to make. While discussing essential, while arguing that domestic workers as essential workers require also specific coverage and should be included in all the protections, many people, many organizations brought up this public health argument that I haven't mentioned a slide before, but I am doing it now, but it all comes together. So the argument was that since we are essential workers, we come in contact with many people. This is risky for us, this brings hazards for us, but it's also risky for other people with whom we are in contact. So for instance, using this narrative, the organizations were pushing for the inclusion of domestic workers as essential workers in the vaccine rollout plans. And here again, this all brings us to the third argument, how the immigrant rights, immigrant issues were really crucial because of what we've just said, that undocumented workers were excluded from many things, including of course, the healthcare system and access to the vaccines. So organizing around, for instance, against mass evictions in this, as we see in the slides, or on the left, you can see an initiative that I wanted to include here because we can clearly see this the pandemic, everybody is wearing a mask, trying to keep a little bit of distance at least. So these kind of actions were also being organized. It was against the wage theft. So a very basic, specifically, that was specifically affecting the immigrant community. So these were some of the actions that we have seen. And the work is not over. Pandemic is not over. Pandemic will not be over even when it is over for real, because we will be dealing with the outcomes, the impacts for years to come. And this is one of the examples of how domestic workers organizations are trying to stay on top of everything and making sure that even when for instance, the mask mandate is being lifted, the domestic workers and other workers are protected.
Could you please sum up, Anna?
Yes, Elizabeth will do it very briefly.
We want to conclude and just note that the organizations that we've talked about acted as a kind of shock absorber to mitigate the effects of the pandemic on the workers to the best of their ability. And as we move back towards like a new normal or reopening, unfortunately, we see things really going back to the ways that they were before. One very, very brief example of this is that President Biden's grand plan for reboosting the American economy, the American Jobs Plan, included a very robust section on the infrastructure of care work and building that up. And unfortunately, last Thursday, the president rolled out the new bipartisan American Jobs Plan, where all references to care were cut as a kind of a bilateral compromise bill. And so we see that things are unfortunately back to normal with care workers being sort of dismissed and put on the bottom. And we will just mention that we have a forthcoming chapter that talks a lot more about this, and there we will put the link to Anya's report on domestic workers in the pandemic in the chat. Thank you very much.
Thank you very much, Elizabeth. Thank you very much, Anna. And also thank you for sharing your links in the chat box. For all of those, I know that some people had technical difficulties seeing Brid during her presentation, and some of the presentation wasn't on full screen. So don't worry, all the presentations will, also be available afterwards. So you'll be able to read up on stuff and hopefully get in touch with the presenters and authors of these papers to discuss. So we have approximately 10 minutes of discussion, and then we'll watch the great video by the Dom Equal project. So far, I haven't seen any question except one question from Vera Pavlu, who has written into the chat. I have a question for Carmen and Gemma. I hope I'm pronouncing your name correctly. You mentioned that ILO Convention 189 and UN SDG 5 were important in changing the gender paradigm of care towards more co-responsibility. Could you expand a bit on this? How did these international developments influence the national debates in Spain? And how about the influence of EU law? The EU has recently adopted a new directive on work-life balance. I think that's a very prescient question. So I'll just give you a moment to reflect on that before we bring it in. Are there any? I don't see any other questions, or am I missing anything? I don't think I'm missing anything. So I'll let Gemma, I'll let you come in on that.
I think we're good.
Okay.
Thank you.
Thank you very much. So I'll let you come in on that. So I'll let Gemma, I'll let you come in on that. So I'll let Gemma, I'll let you come in on that. So I'll let Gemma come in on that.
Trato de hablar despacio en español, o si queréis puedo contestar en francés. En inglés no creo que lo pudiera hacer claramente. Lo intento en castellano y si no, bueno. En España, la Agenda 2030 está empezando a ser parte de una estrategia multinivel, comunidades, bueno, Estado y gobierno, ministerios, comunidades autónomas y municipios ya desde hace un tiempo. Entonces, muchos de los contenidos de la Agenda 2030 están empezando a filtrarse en las políticas. Los dos más potentes por ahora, claro, desde nuestra perspectiva laboralista, es el ODS 8 del trabajo decente, y vinculado a ese estaría todo el movimiento del trabajo decente de la Organización Internacional del Trabajo, que empezamos a mirar con gafas ILO. Entonces, claro, el trabajo doméstico tiene un convenio internacional solo para trabajadores domésticos y aparece la palabra trabajo decente. De ahí que sea un elemento de sinergia. Por la otra parte, la Agenda 2030 y el ODS 5 incorpora exigencias de igualdad y de igualdad de género. Y en España, desde hace ya mucho tiempo, todos los movimientos feministas llaman la atención sobre el hecho de que los cuidados, la asunción de cargas familiares y de la responsabilidad del cuidado de personas y cosas recae por una cuestión cultural, ideológica y por una tradición que se arraiga incluso en regímenes políticos no muy antiguos, pues hace que esa carga, decía, recaiga en las mujeres, y eso lastra toda su inserción en el mercado laboral. Nos ha retardado. El mercado femenino español, pues es un mercado muy distinto al de otros países europeos, y ahora que en términos cuantitativos puede estar equiparado, la realidad de las mujeres trabajadoras pues es muy diversa seguramente a la realidad de otras mujeres en otros países, de tal manera que al final es los cuidados el elemento diferencial. ¿Qué sucede? Que elemento de igualdad es el de garantizar políticas de conciliación sin género, de tal manera que mujeres y hombres, los dos, cuiden. Hasta ahora las políticas de conciliación han venido sin querer siendo un boomerang. Eran políticas de conciliación que habilitaban derechos de ausencia que ejercían casi siempre las mujeres. Un dato: las excedencias por cuidado de hijos, que son excedencias, significa me voy de la empresa y no sé si volveré. Normalmente las han venido disfrutando 90 y pico % de las personas que disfrutan las excedencias son mujeres. Claro, eso significa que las mujeres, por cuidar, sufren brechas en el mercado laboral. De ahí que las nuevas políticas de conciliación se fijen en cómo tratar de crear empleo de calidad en el sector de los cuidados para que sea un sector más y que además se favorezca que se desarrollen políticas de conciliación. ¿Dónde está la clave aquí? Por ahora, estas políticas de las que hablábamos la profesora Grau y yo, de subvencionar el cuidado, no subvencionan a mujeres. De ahí que también los hombres que puedan acreditar que están externalizando el cuidado van a poder ser beneficiarios de las ayudas públicas por cuidado. Y ese es un poco el cambio de paradigma, dicho de una manera muy rápida. Espero que los traductores hayan podido hacer una traducción mínima, pero ese es el anclaje, si queréis, en el que apoyábamos ese ODS 5 vinculado al trabajo decente desde dos órbitas, en este caso internacionales, pero que en España empieza a ser muy potente, y ya pues creo que los que hemos visto el potencial de la agenda y de los convenios OIT tiramos de ahí, porque el derecho español necesita empezar a tener en cuenta, es un derecho muy progresista, pero no ha tenido en cuenta la perspectiva sociológica del sustrato al que se aplica. Entonces, cuando damos derechos, las mujeres nos tiramos a coger derechos de conciliación, no tanto los hombres, y entonces hay una dinámica social interesante. Ya.
Armin, Gemma, I think because we need to, we're finishing at 3:15 and we have the 5-minute video still. So I'm really sorry that there's not much more time. And I know that there's the questions to the other participants as well. And under normal circumstances, we would be able to continue, these discussions in the hallways and corridors and over cups of coffee and other beverages. And so it's a shame, but so there's a question to Wendy from Karin Pape as well as Manuel Abrantes. and Karin asked, like, how do you manage to reach out to these workers as a union? You know, that's something that should be attached. It should be addressed very quickly. And Manuel asks, like, how can we develop collective bargaining in countries where there aren't those structures? So maybe you can, you know, speak for 2 or 3 minutes about that, Wendy.
A ver, la distribución en el territorio italiano de las siglas sindicales y de las organizaciones sindicales mayormente representativas es en lungo y largo en todo el país, en todo el estado italiano. Como experiencia FILCAMS, en el 2012 se hizo una campaña indirizzata al tesseramento, alle intercettazioni delle lavoratrici di questo settore, fatta di due questionari, uno che parlava alle lavoratrici chiedendo, la prima domanda che mi ha impressionato tanto è stato: qual era il tuo progetto migratorio? Perché spesso quando sei una lavoratrice si esce del proprio paese con un progetto migratorio che poi passano tanti anni e questo progetto non è stato raggiunto, ma tu continui legato a quel pensiero e non ti organizzi per richiedere diritti nel paese dove stai lavorando e dove probabilmente arriverai a avere una pensione. Il secondo questionario era rivolto ai datori del lavoro che chiedevamo il perché non volessero mettere in regola i propri datori e i propri lavoratori, o quali erano le difficoltà che incontravano dal punto di vista economico, retributivo, contributivo, insomma, qual era la spesa economica che impediva che un pensionato di un lavoro umile o comunque di un lavoro non stratosferico, perché non parliamo di grossi dirigenti o di persone molto capienti e avvienti, perché non assumeva la badante pagando i contributi e quant'altro. E lì siamo riusciti a capire quali erano le difficoltà da una parte e dall'altra, e una equipe dentro la FILCAMS a livello capillare ha creato una piattaforma al suo tempo, presentata al suo tempo, del quale si è ripartito per lavorare per colmare ancora queste lacune. Quindi alla base un lavoro sistematico, un lavoro preciso nelle cose che mancano. Quindi credo che interfacciarsi con i datori di lavoro, con le lavoratrici, sia quello il nostro punto di forza. Non so che altro dirvi, perché comunque noi siamo sempre sul campo, in diversi sistemi, andiamo a contattare le lavoratrici sui loro punti di aggregazione, che possa essere un mercatino, che possa essere un call center, le chiese. Abbiamo fatto con gli enti bilaterali una campagna capillare di informazione, quindi ci sono le pagine social sia come FILCAMS che come FILCAMS, Call e Badanti, e noi ci proviamo anche a comunicarlo nei nostri diversi punti di tutela individuale per ogni lavoratrice. Quindi questo è il nostro punto di forza, ne andiamo tanto orgogliosi perché riusciamo a contattare le lavoratrici in tempo reale.
Thank you very much, Wendy. I actually said there's no time to have, you know, like the discussions in between the meetings, but there actually is, because we're using this wonderful application called Wonder. So I'll give more details about that in a minute. I would like to thank all panelists for taking the time out of their day and presenting their ideas with us today. I think we've learned a lot about the different, you know, contexts, whether it's in Spain and how, you know, the authorities are, you know, trying to develop conditionalities on funding, whether we see how the kind of challenges that Wendy outlined, or how Brid, you know, spoke from a kind of human resource management perspective, on the challenges that they face in the sector and how they try to create decent working conditions as a business and service provider, as well as lastly, the very good insight from the United States in a changing political environment. Last but not least for today, we actually have a great video coming up, and it's a privilege to introduce this video because it's the project is by Sabrina Marchetti from the University of Venice as well. And I once met Sabrina back in 2014 at a corporate care conference she organized when I was a PhD student. Unfortunately, my paper was never accepted for the follow-up publications, but you know, those things can happen. But the video that we're screening today is part of a longer project, which includes 6 web documentaries about different aspects of domestic workers' campaigns for rights in Europe, Latin America, and Asia. So a truly global perspective that the Dom Equal project is taking up there. And the web documentaries have been produced as one of the final outcomes of the research project, Sabrina Marchetti's research product, Dom Equal, a global approach to paid domestic work and global inequalities. The documentaries were made by Caterina Sartori, so big up to Caterina Sartori. And as you will see, they're based on interviews with activists, researchers, and edited together with photos and music about and from domestic workers in 9 countries where the Dom Equal team has conducted research, amongst others in Colombia, Ecuador, Brazil, Philippines, India, Taiwan, Germany, Italy, and Spain. So that is a whole, you know, that's a great number of countries. Today we will present a short version of the documentary about Convention 189, 10 years afterwards. Whilst the 5 documentaries are dedicated to the conditions of domestic workers in the world, domestic work and migration, and domestic workers struggle from an intersectional perspective, and the relationship between domestic workers and feminist struggles, which I think is quite important if we're looking at the global movements for domestic workers' rights. And lastly, the impact of COVID-19 on domestic workers' groups. And on behalf of the Dom Equal team, it would be great if you can check out their website, and I'll post it in the chat below, at domequal.eu, and their Facebook page. And I'm also aware of that Sabrina Marchetti runs another Facebook group on research in the domestic worker care, in the domestic work sector, where there's always great updates. So I'll share we'll watch the video, and after that, I'll share the slides about how you can join Wonder and contribute to the discussions. So Dimitris, I'll have.
De todo el mundo y te paran fatal. Levántate, entrada del hogar, lucha por tus derechos y visibilidad.
ILO Convention 189 is some sort of a Bible for domestic workers.
El convenio 189 nos indica y nos ha dado herramientas prácticas y claras como para decir, somos una trabajadora.
The key message of the convention is that domestic workers should be treated as other workers in their respective countries. It combines a labor rights approach with a wider struggle for the human rights of particularly vulnerable subjects. And one can say that the convention incorporates an intersectional approach.
Queremos currar en condiciones, con contrato y seguridad, basta ya de precariedad. Queremos currar en condiciones.
It's important to note that the ILO process only came about as a result of the activism of domestic workers themselves, along with their allies. In particular, some domestic workers movements based in the Global South had a lot to teach, and in fact have still a lot to teach to organizations in other parts of the world.
As discussões foram, em 2010, as discussões foram muito difíceis, porque tinha o empregador lá que ele não aceitava as nossas condições.
I do firmly believe it did make a difference to have these women at the table, and I could see also from some officials in the ILO that they really appreciated this contribution.
Então, quando a gente conseguiu tanta luta, porque a gente ficava até de noite lutando, quando conseguimos, que a última pergunta, que não teve adendo, que foi conquistada e que ele bateu o martelo, isso foi uma alegria muito grande para a gente.
Ha cambiado la ley, eso está fatal. Nos han bajado el sueldo y hay más precariedad. Levántate, empleada del hogar, lucha por tus derechos y visibilidad.
En el momento de la ratificación del convenio, créalo que eso fue lo más lindo que pudo haber para nosotras, porque perdón, que esto siempre me motiva.
Well, I won't say it's been perfect, but we really have had a lot of great strides in promoting decent work for domestic workers.
Que en Colombia el 189 no ha tenido una implementación correcta.
Porém, nem todos os empregadores têm a consciência cidadã de respeitar isso. Então, por isso que a nossa luta é uma constante para que a gente possa garantir esse trabalho, essa lei.
Since its enactment in Geneva in 2011, the convention has continued to represent a motor for change globally. Today, 10 years after the adoption of C189, we see that the campaigns for the ratification continue all over the world. But at the same time, even in countries that ratified the convention, its actual implementation is still far from being achieved. And for these reasons, the domestic workers' organizations and their allies are fighting hard for it to become reality and not only remain a beautiful declaration of intent on paper.
Llegó el momento de hablar muy claro, cambia el concepto de los cuidados. No es solo el trapo y la cocina, es todo el curro que hace que gire la vida misma. La explotación se siente. El cambio es urgente.
Okay, I'm quite proud of myself that we only overran by 7 minutes. I would like to thank all our speakers and contributors once again for participating. How great is it to listen to such powerful, women speakers on a panel and get inspired, that ratification is, possible everywhere around the globe and in the EU. And we hope that our meeting today actually contributes to, other EU member states being inspired and taking the next step, ratifying and in many cases improving the working conditions of domestic workers. So in order to join, we have a break now. If you want to network and have an informal chat, please join us on the Wonder platform. You can please use the link provided in the chat to access the room. So I think someone just posted it right now. And you please use Google Chrome on a laptop or desktop computer. Mobile phones and tablets are unfortunately not supported. And you need to allow the app to access your camera and microphone and type your name in when you enter the room. And you'll see different thematic areas where you can put your profile according to your interests. And you can start a conversation by simply dragging your photo with your mouse over another person's photo. So thank you very much. I hope you all enjoyed this session, and the next session starts at 3:45 Central European Time, so at 3:45. Please make sure to be punctual, and we'll be dealing with tackling undeclared work in the domestic work sector. And I hope to stay in touch with many of you, and please reach out. Talk to you later. Bye-bye.